H3N2 virus kills 2 in India, a wave of cough and fever intensifying across the country, Centre issues advisory. Deaths reported in Karnataka and Haryana, cases rise in major cities. Click on the link in the description for more details. Deaths reported in Karnataka and Haryana, cases rise in major cities. The first 2 deaths due to H3N2 influenza virus have been reported in India, reportedly in Haryana and Karnataka. Health department officials said on Friday that the victim from Karnataka had fever, sore throat and cough and had symptoms of influenza-like illness, ILI. Amid rising cases of influenza, flu, H3N2 virus, the Government of Karnataka has now issued an advisory and guidelines. Seasonal flu is a contagious disease that can spread from person to person through the cough or sneeze of an affected person or through contact with droplets on hands and surfaces. This self-limiting infection with minimal morbidity and mortality lasts for about 5 to 7 days. The state government said in the notification. As per the latest data available on IDSP-IHIP, Integrated Health Information Platform, a total of 3,038 cases of different subtypes of influenza including H3N2 have been confirmed by the states till 9 March 2023. This includes 1,245 cases in January, 1,307 in February and 486 in March, till March 9. According to the Centers for Disease Control, CDC, and the World Health Organization, WHO, H3N2 is a subtype of influenza A virus, which is an important cause of human influenza. According to WHO, avian, swine and other zoonotic influenza infections in humans can cause illness ranging from mild upper respiratory infection, fever and cough, to severe pneumonia, acute respiratory distress syndrome, shock and even death. According to the IMA, this virus usually preys on people below 15 years or above 50 years of age. Children and people with comorbidities such as asthma, diabetes, heart disease, a weakened immune system and neurological or neurodevelopmental conditions are at higher risk.